As we get ready to head into spring here in Canada, it's always an exciting time of year as everyone wants to get outdoors more and use their bodies. And it means we need to make sure our health is in a good spot after, what for some people may have been a winter of hibernation. In this study here from the journal, what's called JMPT, so short form, JMPT, it looks at 311 chiropractic patients aged 65 and older who had received maintenance care. So not one-off, go when you're in pain, but repetitive, continual care to stay healthy for 5 years or longer versus healthy citizens their same age. So not sick people, not people in the hospital, but people who on the outside would appear similar. And what the study showed is that chiropractic patients spent only 31% of the national average on healthcare. So despite paying for their chiropractic care, et cetera, they still spent 70% less on health than the average person their age. They had 50% less need for medical provider visits. And here's some of the big ones at the bottom. 60% fewer hospital admissions. So they went to the hospital way less. If they did go, they were out 60% faster, and they spent 85% less on pharmaceutical costs. So huge stats. And again, it's the difference of maintaining and building health over time, right? You will get out of your health and your life what you put into it. Everything you do, like every time you get adjusted, every time you do your home care, every time you take your supplements, every time you apply more and more of the 5 essentials in your life, it's like putting a deposit into your health account that you get to reap the rewards of after. Now, many of you know my mom had a slip on her steep driveway in BC when it was icy, and she suffered a small fracture in her shin, just along the knee joint. The treatment for that was an immobilization brace to take weight off the joint, and she was told for 6+ weeks. My mom was told because of her age, 88, it may be longer. At her 2-week follow-up, the fracture clinic told her that things look good, all stable, but the prognosis because of her age is still likely 6 or more weeks. But then at her 4-week follow-up, the specialist said she can take the brace off and start weight bearing rehab and get walking. Not only did it not take longer as they had guessed, but she was out of it 2 weeks earlier than would have been normal for anyone else, even someone 20, 30, 40 years younger, right? And this is all because of the investments my mom had been making into her health for decades previous. A lot of my commitment to health came from my parents who were living the 5 essentials before they were called the 5 essentials. Like most people don't realize there's 2 very different paths for health. The one, that my mom chose, getting adjusted every week, making healthy food a priority, moving, avoiding toxins and unnatural stuff, which is more work than the average person is told is good enough. But that average road that people are told to take leads to what stats show is ending up with 1 in 1,000 people making it to 60 being healthy, right? But they aren't told the shortcuts they're making along the way are going to cost them their independence and doing what they want to do come when retirement shows up. So spring is coming, and it's time to take that next step for your health. If you've fallen off anywhere in your 5 essentials, tell us. We will help you. We will support you and get things great again. If you know others who want better than where they are right now, or they're headed, or maybe want better than where they're headed, like they know things aren't going in a good direction, let us know how we can help, or you can give them one of your compassion cards. Together, this can be a great spring for everyone we know.